these simple tests. So here's an example, and the question of the test in this case is just this symbol here. And there's two answers, and I can't really tell it what's A, what's B, but I can grade the test. I can have it kind of pick an answer and grade the test. So let's say the computer chooses A here. In this case, I'm telling it it's wrong. What does it do? So the computer updates its kind of internal state of being. We call this a representation, and there's a number of different terms for this, but it updates its state of mind, if you will. And then we go to the next question. Well, here is a different symbol, and it just has to guess an answer. So it's going to guess A again. And hey, in this case, it was right, so it gets a point. And again, it updates this representation. Now, here's another thing that it's seen this one before. So hopefully from that representation that it updated earlier, it would guess the correct answer this time, which is B. And so on and so forth. We do this, and it updates the representation. And what you end up with is this kind of final representation after it's taken its test. And we can call this a computer program. And what it does is it takes this symbol as an input, and it predicts the correct answer, correct in quotes here, whether that's A or B. So we can now use this program for new symbols, or I should say for symbols that weren't in the test. So if you see one of these, well, we know that's a B. You see one of these, we know it's an A. But hey, this is something that wasn't on the test. One of the limitations of AI actually is that it has to pick an answer, basically. So it's going to pick A in this case, even though that's not really valid. So this begs the question. So again, we didn't specify anything kind of real here. We just gave it answers. So is B, does it mean that, was my intention as the human designer of the test that B is diamonds, or did I mean that B is actually red? Similarly, did I mean A is clubs? Did I mean A is black? Or there's other things too. Is A just curvy lines and B is straight lines? Like, because this has straight lines here and this has curvy lines. Like, I don't know. And that's the point. The computer doesn't know. It just knows what we told it, which I think thinking about it in this way really highlights some of the limitations of AI, and also kind of gives you good examples of what you can use it for. So fundamentally, computer representations are limited by the human factors, the data set and the design of the test. But the good news is with enough data, they can significantly outperform humans at that specific test. So what do I mean by limitations in the human factors? Well, here's an example. What if the test was all diamonds? Well, it'll get good at answering the question or it'll get good at turning a diamond into a B, but it's literally never seen anything else. So that's an obvious issue. Now, when you dig into this a little bit more, and I think with a real example later on, this will make more sense, but is the reason that the test is all diamonds because that's how it is in the real world, or did the designer of the test kind of incorrectly include only diamonds in this example, basically? So this is when you see in the news and out there in the public things about bias in AI, like it all comes down to this, basically. It's the design of the test and the data used to create this test. Here's another example. Well, what if, in this case, what if this was supposed to be a C, but we only have two answers? So again, the design of the test and the availability of the data. So just again to highlight, computer representations, they're limited by the human factors, but with enough data, they can outperform humans. What about human representation? So how do we learn about stuff? Well, the cool thing is we're able to switch off different representations, and we learn from other people. We learn from language, from education, from our life experience. So if I now give a human a task to tell these two apart, well, you can use the representation of color, and it does a tremendous job. But now if I add this, well, humans can just on the fly switch to a different representation, which in this case is the representation of suit, and that also does a great job, basically. And so on and so forth. We have size is great as well. Here's an example of a great use of human representations. If you show this to a trained radiologist, they'll be able to tell you if the patient has cancer or not. This is a really complex test. And again, the trained person will use different representations, number of nodules, the size, the shape, et cetera. And they're pretty good. I mean, this is the standard of care. And this is a lung cancer CT scan. But we can train computers to do the same thing, doing kind of exactly what I was just talking about. So let's say we got a bunch of pictures of CT scans. Well, we can, and we know the answers. Well, I can show it to the computer and say, nope, you were right, you were wrong, et cetera, and go on and do this. And what does this do? It generates a computer program that takes in a CT scan and tells me if the patient had cancer, yes or no. And in this case, A means cancer, B does not. This is just a fancy computer program, so we call it AI, but it's exactly the same thing that I showed you before, the same very simple methodology, basically. And it's exciting. We've actually been able to do this for both for lung cancer and for breast cancer. So in an example here where the test that we gave the computer was actually 42,000 tests long. So you're already starting to see some of the limitations. We needed that many lung cancer scans where we actually knew the answer. We showed in this case that it actually performed as well as humans, with actually less false positives and less false negatives. So obviously the false positives, this is where people had a workup that in many cases is invasive, requires surgery, et cetera, but maybe that wasn't necessary. And the false negatives are the reverse, where the person didn't have a workup but ended up getting cancer, basically. So this actually is a real example of a nodule that was deemed to be benign, but actually was the AI correctly predicted it as not benign. And there's the reverse too, which is super interesting, where the human gets it correct, basically, and the computer doesn't, which opens up a whole interesting area of inquiry. What's interesting too about this is that sometimes in 1 year, so if you compare now the false positives and the false negatives to a kind of what happens a year from now, there's agreement between the human and the computer. But if you ask the question, compare in 2 years, now there's disagreement. So it's a predictive capability in addition to just being more kind of accurate, essentially. This is our example for mammograms. Again, now trained on even more examples from multiple countries. In this case, we showed that it performed as well as humans with less false positives and less false negatives as well. And this is an example, again, of a cancer that was deemed, or this was an example that was missed by the human and was caught by the computer. And we have equal number of examples the other way around, which again are super interesting. So what are some limitations to all of this? Well, I think, we've kind of set it up in a way that some of these hopefully will be pretty straightforward. So again, this just does one thing. It takes in an image and it tells you cancer, yes or no. There's a whole host of things. When you go back to a CT scan, for example, there's way more than just the lungs here. You got the bones. If you're at the right level, you have the heart, and you have other things, arteries. So this is a very complicated task that, or set of tasks that humans are doing. We're really just carving out one kind of really select slice of what's going on. Requires a lot of data, as we showed, many hundreds of thousands. And two big ones, which we're going to go into, are, let's say you have this one really small slice of the clinical picture. How do you actually integrate this into real workflow? This is a very challenge, and we'll kind of show one of the examples that we have at our institution. And then this is the one that I mentioned earlier. Again, if the data set is biased in some way, or you have the wrong data, or the test is missing some answers, or it has too many answers, you run into the same exact issues, basically. So really careful, deliberate design of these tools is necessary. So let's talk about this integrating into the actual workflow. So this is an example of actually a clinical trial that we're running now for mammography. And I have kind of the workflow here, and I'll walk through it just to highlight the complexity of everything that's not the AI. I mean, it's really important to get everything right, including the AI, so that ultimately, if you show that it works, it's up to a scientific standard, and also so that you build trust both for providers and patients that this is a real thing. So this is just in order to study this, just in order to kind of prove that it works. You first have to essentially ask a bunch of patients to participate in the study, and then some people don't respond to their email or whatever, so you have to keep very close track of who's in and who's out. And then you always have to have a control group. So someone comes to get their mammogram, or this could be lung scan or other clinical AI we're developing, and you need a control group. So in half of these folks go home and nothing else happens. We just kind of watch them and see where they end up. But for those that are in the experimental group, they get a mammogram. Now, this is where the kind of technology aspect of this is super interesting. The person we have to basically read this right after it's taken. We don't have the luxury of time here. So a lot of technology has to be built. Again, not to build the AI, that's already done, just to get the scan to the AI and back, in this case, to an email that goes to our staff. That's actually quite a lot of work and quite a lot of effort that, we're very fortunate to have amazing IT professionals in our institution that are able to help us with this. So the email goes to the person that's running the study, and basically then if the AI thinks that there's cancer, it gets sent to a radiologist who then also has to basically look at the scan while the patient's now been waiting since they were done with their scan. They're waiting in the waiting room. So now if the radiologist agrees that, hey, this is could be something that needs follow-up, we are able to, because of AI now, offer a same-day workup. So in the past, people would sometimes, this process would take up to a month, but now, just due to prioritization with the AI, we can have this occur in a matter of hours, essentially. And of course, if there's disagreement, then it goes back to the normal way that you would get a mammogram read. And this, again, this is not, this is purely just to prioritize scans that need to be read sooner. This isn't even the sort of quote unquote next step, which is let's just have the mammogram read by an AI. Like, we're just talking about reordering the order that which they're read by the human, and it already opens up a huge avenue of workflow changes and technology solutions that don't exist yet. So really just to emphasize that we're very early on in this process and that there's tons to learn about this. So delving a little bit into one of the other issues requiring a lot of data. So it turns out that the computer systems designed for healthcare were put into place actually a long time ago. And this is stuff that's not, I would say, people that don't work in this space aren't necessarily as familiar with this. But for example, the underlying language for a lot of United States here, I pulled this from Wikipedia. 40% of the hospitals in the U.S. For 54% of the patients use this technology that first appeared, in 1966. So we're talking about something that's 50 years old that we still use for a variety of reasons. So back to here, connecting the scan to a modern AI, in this case for this study, connecting it to a modern AI designed by Google, which is like a cutting edge tech company, requires quite a lot of engineering and structural stuff put in place to make this happen, basically. And the same goes, this is for medical records, same goes for imaging. The U.S. was very forward thinking, I think, in digitizing images, in the mid 80s. But now we're stuck with some of these old standards that, again, work very well in the current environment for taking care of patients. But when it comes to aggregating hundreds of thousands of images, when it comes to, with very low time, sending these to a cloud where they're processed by AI and come back, that's where we run into a lot of challenges, which is what we strive to overcome. So that's all I have. Very much open for questions, and happy to discuss anything further.